As India marches towards 1 lakh fatalities, the last 6 months of COVID-19 has crippled not only the economy but also the larger health infrastructure affecting many. According to the World Health Organization, India leads in the number of tuberculosis cases with almost a quarter of the total cases being reported in the country. So how has COVID-19 affected the TB program in the country? Tuberculosis is not a new disease. In 2018 alone, around 26 lakh people fell ill with TB in India. Like COVID-19, it primarily affects the lungs and has similar symptoms like cough, fever, and difficulty in breathing. However, TB has a longer incubation period and slower onset of the disease. Many don't even realize that they have TB unless they are tested for it. This can be fatal during a pandemic like this. I reported earlier this year how undiagnosed TB patients might be especially susceptible to COVID-19 as their lungs are already compromised. Moreover, there has been a 35% decrease in TB case notification between January and September compared to the previous year during the same period. A disease is said to be notifiable when every incidence of it has to be reported to the government, including those who approach private facilities. The reason for the decrease in numbers may be anything from people's inability to travel to the health centers during the lockdown to the diversion of health services and staff to tackle the pandemic. However, the government waited till the last week of September to address this issue. According to a September 24th government order, all newly diagnosed TB patients or those currently on treatment will be tested for COVID-19 by RT-PCR, TrueNat or CBNat. All COVID-19 cases should also be screened for TB symptoms if symptoms persist for more than 10 days. TB screening has to be done for severe acute respiratory infection cases or SARI cases if symptoms persist for more than 10 days. While this is good news, can the TB program handle more cases with the resources being severely hit by COVID-19 and subsequent lockdown? The RNTCP or the Revised National Tuberculosis Control Program is responsible for curtailing the spread of TB and decreasing mortality and morbidity. Under this program, diagnostic and treatment facilities are offered free of cost to the patients. The program follows directly observed treatment, short course or DOTS strategy, where the patient has to visit the nearest health center for tablets. TB health visitor provides the prescribed TB drugs and watches the patient swallow every dose. Though the treatment lasts 6 months, patients are expected to come to the center only for the first 2 months until they test negative. This helps in preventing the spread of TB to others. It also decreases the chances of treatment failure and relapse. RNTCP also has a database named NICSHARE, which contains information about all TB patients, including multi-drug resistant cases across the country, and this database is used for monitoring TB patients. In Karnataka, there is a tuberculosis unit or a TB unit for every 2.5 lakh population. On the whole, there are 271 such units in Karnataka. Over 45,000 cases have been reported this year until September, and 2,634 patients have succumbed to TB. Compared to previous years' 90,000 cases, the cases notified have been halved. But this does not mean the incidence of TB has reduced, but rather the notification of TB cases has been affected due to a number of factors. Since last week, National Health Mission workers of the state are on strike, demanding salary on par with the permanent staff of the health department. This has adversely affected the TB program in the state. Around 1,300 National Health Mission workers who work with RNTCP and upload patient data onto the NICSHARE website are now on strike. Based on this data, the monthly 500 rupees, which is usually transferred to these accounts for TB patients' nutrition, has also been affected by the strike. With COVID-19 tightening its grip over the nation, is there a way we can tackle TB without ignoring the current threat of the pandemic? Last year, Prime Minister Modi had announced that India would be TB-free by 2025. Even the World Health Organization has put forward a strategy to eliminate TB globally by 2050. However, with the country leading in the number of multi-drug resistant TB cases and limited progress in diagnosis and drug development, this would be a difficult dream to achieve.